Good afternoon, everyone. I'm very happy to talk about the factor associated with unsuccessful tuberculosis treatments among the Hill tribe and stateless population in northern Thailand. You would see that numbers of speakers are from Thailand because we have at least 70 countries highest burdens of tuberculosis from WHO several years. So my point is that even we have a very good enrichment and a very successful drug developments, but we still have the major problems on the unsuccessful tuberculosis treatment, particularly in some marginalized populations. What I'm doing. So, what I should do? This one. Is a big. Oh, sorry. I have no conflict interest to declare, but the project has been, supported by the National Research Council of Thailand, and we know that tuberculosis is the major cures for human life. For several years, is almost 1.2 million people die from TB, and 11 million people for infections for the tuberculosis in 2023. And also, we do know that, as I said, we do have very strong regimens for treatment, but still numbers of patients fail for treatments. And the major components that are having for this unsuccessful treatment is poverty. So I'm talking about my project, which is conducted in Thailand. We have 70 million people living together in 500,000 square kilometers. And we do have almost 5 million people is identified that the Hill tribe and stateless population who migrate down from the South China along the centuries. And, even when we have unpolitical stable for our neighboring countries, we do have much small numbers of people from our neighboring countries into Thailand. And TB is one of the major problems. And those, the Hill tribe and stateless people, 30% they didn't get Thai ID cards for VCC used for SSS for public service, including the healthcare service. And 70% are living under the national poverty line. And yes, they are having problems about income. And the Hill tribe and stateless people, they have their own, unique languages and also their custom and daily life. And also they are working on farming, and 70% not speaking Thai. And this is my studying sites. If you feel that, I'm not, you feel that I'm not very happy in living in the urban, like Tokyo, please come. This village is very beautiful. Yeah, the objective is to determine the factors and success TB treatments for the Hill tribe and stateless population living in northern Thailand. I did, a mixed methods components of the qualitative and quantitative method to gather information and analyze and present the result. The study population is the Hill tribe and stateless TB patient attended in one of 18 district hospitals in Chiang Rai province. And we list the TB patients 5 years from 2019 and 2023, and separate a group of success and success before get randomly select 133 unsuccess TB and 267 cases of TB success for the case control. And then 20 cases of TB, 10 success and another 10 unsuccess TB cases, including 5 people of healthcare professional interview. Logistic regression was used for, extract the factor and content analysis. This is the general characteristic of the population. Most of the TB cases are male and older than 60 years and no educations, and they are working in the farming with a low income. And also, they are living with a number of family members. So I will skip this one. In the multivariate analysis, the stepwise logistic regressions, we found 7 variables related to unsuccessful TB treatment. The first one is the visited TB, the way to bring themselves to the TB clinics. Those who have oneself to bring themselves to TB clinics much more greater risk for unsuccess compared to with having other people bring them to the clinics. The side effects is also detected as a risk factor for success. Now forget taking medicine, HIV status, and depressive stress and knowledge were detected related to unsuccess for TB treatments. Look at in the qualitative departments, we do have numbers of variables that detected as the unsuccessful TB treatment among these populations, like the affordable for TB treatment stigma, lack of medical specialization in the district hospital, because we gather information to both patients and healthcare professionals, and a missing understood of a DOTS system, and also transportation and overload and quality of care. AI missing, in diagnosis because we use some hospital, they use a mobile X-ray, and the mobile X-ray we found that 30% is missing, misdiagnosis. And then the mental health, the side effects, the number of family, and the status of living in Thailand are also acting as their, affecting for the unsuccessful TB treatment in these populations. Conclusion. I would say that several personal and socio-economic determinants are working as their contributions to the unsuccessful TB treatment in this population. And also the structural violence, I'm talking about the law and regulations that are getting for Thai ID cards. If anyone who have a Thai ID card, they will be getting to the civic free of charge. If you don't have, you have to pay. And as the standard of new TB case, 20,000 baht for the first 7-day intensive care periods that they have to pay. So this is the major problems for the TB unsuccess for the stateless populations. Political, economic, of health. Yeah, we do have some issue of the amounts of national budgets allocated for TB. This is also one of the factors that are related to unsuccessful TB treatments. We do need the specific strategic integrations, local life, and also health system should be implemented for this particular population to improve the TB treatment outcome. So this is the reference. Thank you. This is my team. Thank you very much.